our regional press conferences about paid sick days in Virginia. I am Kim Bobo. I'm the Executive Director of the Virginia Interfaith Center for Public Policy, and I'm one of the coordinators of our Virginia Paid Sick Day Coalition. This press conference today in the Hampton Roads area, focusing on Hampton Roads area, is really going to focus on the concerns of businesses and why paid sick days are good for businesses, and the concerns of our healthcare industry and employees, why this is good for healthcare in Virginia and why healthcare practitioners really believe Virginia needs a paid sick day standard. So we have a star-studded panel this morning and lots of doctors in the room, although not medical doctors, but professional doctors. So we're going to start with Frankye Myers, who is the CEO of Quality Assured Health Aides and the former Chief Nursing Officer of HCA. Ms. Myers, would you talk with us about paid sick days?
Hi, how are you? Yes. Paid sick day, I kind of bring both perspectives. Coming from the role as a chief nursing officer and working for one of the largest healthcare corporations in America, it was so imperative that our staff had that so that they would not come to work sick. So they knew they had that time. You know, it's when people have to take care of their families and they don't have that time, then they end up putting other individuals at risk by coming to work sick. And as a business owner, I think it's imperative that we support the work of the coalition and support having paid sick day standard so that it's a public service. As we're living through this pandemic, we're seeing the impact of if people are sick and they're around others who may be compromised or others who are not compromised, that we end up having a situation where we're putting others at risk. And so this initiative is so important to be able to provide that for our community.
Thank you, Ms. Myers, both a medical perspective and a business owner perspective. We're going to turn to another business owner, Ms. Kelsie Cross, who is the owner of Commercial Welding Solutions in Hampton. Ms. Cross?
Hi, so I'm Kelsie. I own Commercial Welding Solutions, and this is only our second year in business. I am going to employ at least 2 employees this year. One of the things that I would love to offer is a paid sick leave. I come from a background of management in a pharmacy, so I kind of understand how the healthcare works and how important it is to have sick leave. Now, I also believe that no one should have to sacrifice coming to work sick and not feeling good, but also spreading it around to other people who might have children or compromised people living in their home. But also, I want to keep my employees around. I want to offer an incentive package to keep them with me. I want them to become a family. I don't want to go through employees because the next job has a better benefit package. So it is just super important to know that your employer is taking care of you. As a business owner, I want to take care of my employees. And if they're sick, I don't want them to come to work, possibly give it to me. I have 4 children, and I just don't think that anyone should have to sacrifice paying their bills versus spreading sickness.
Awesome. Thank you so much. Next, we're going to hear from Dr. Frances Montague, who is a retired assistant professor of nursing at Virginia State University and a current geriatric nurse practitioner. Dr. Montague, unmute yourself, please. I think you're unmuted. Go ahead.
Good morning again, and thank you for having me. I am Dr. Frances Montague, and I am a retired assistant professor from Virginia State University. As a nurse with 50 years of experience, I can see that having paid sick leave is important and essential to all healthcare workers, as well as all other frontline workers. The ability to take care of your health early on means fewer overall sick days, as well as an employee who is not worried about finances while being sick. The minimum wage employee may already be stressed with financial issues or concerns, such as how to feed, clothe, and provide for the family. Any loss of income for their future heightens their concerns and their worries. If there is a sick child or elderly parent that depends on the worker, the decision to work sick or with a sick dependent versus losing a day's income is astronomical. The decision is made based on the hierarchy of needs. The employee will come to work to assure there is food and shelter for the dependent, putting him or herself at risk. It's also important to protect the patient, client, or customer that the worker is going to come in contact with. Going to work sick put others in jeopardy. The spread of infection or any disease will cause or invoke an outbreak in the facility. So as a healthcare worker, as a nurse, I can see, and as one who's been in administration for about 10 or 15 years, as well as work in other areas of healthcare along with teaching, I can see that healthcare benefits will be important and essential so that you can take care of your employee and take care of those they work for.
Thank you so much, Dr. Montague. And now we're going to hear from Reverend Dr. Anthony Fludd, who is the assistant pastor of St. John's Church of God in Christ in Newport News, but has also been in the healthcare field. So Dr. Fludd?
Thank you, Kim. Paid sick days is a moral issue. I agree with one of the great faith leaders, Rabbi Dosick, in his book, The Business Bible, in which he draws a parallel between moral precepts and the business world or workplace. It is here that we are reminded that it is a moral obligation of businesses to help their people to be healthy and well. People trust and cooperate with those who can be touched with the feelings of their infirmities. This is a moral dilemma in Virginia's workplace and workplaces in America. I also want to note that communities of color are the ones who most impacted by COVID-19. They and so many more are employed as frontline workers. More than 80% of food workers and 75% of children workers have no paid sick days. The remedy for this type of racist polarization among low-paying jobs rests in our ability to do what is right. And that is to do unto others as you would have them do unto you. Such a simple moral principle, yet it can make people better. It can make a nation better. It can make better place of employment, because this is how we make America better. Mm-hmm. If you ask, how can we be a better company? I would say by investing in your most precious resource, the health of your people. That is what saves the soul of America. During this General Assembly, we are at an opportune time to do what is right and creating policy that reflect the understanding that it takes time for people to heal, and that it should not be a crisis for those who must choose between taking care of themselves or a sick family and getting paid. As a faith leader and as Vice President of the Virginia Interfaith Center of Public Policy, I support paid sick days and ask that our legislators pass a bill that requires paid sick days for all employees. Let me just leave you with this brief proverb. You have no friends if you are poor, but you have lots of friends if you are rich. It is wrong to hate and disregard others, but God blesses everyone who is kind to the poor. Thank you, Kim.
Thank you. Thank you, Dr. Fludd. We're going to open it up for questions from reporters. And then I know we have at least one other person who wants to share an example of the problem of folks without paid sick days. But let's hear first, are there questions from reporters? Okay, I think perhaps our speakers have done such a good job explaining why this is important that people are don't have any more questions about why they need it. I wonder then if we could hear from Dr. Vivienne McDaniel, who is an assistant professor at Aspen University and the Diversity, Equity, and Inclusion Chair for the Virginia Nurses Association. Again, somebody at the intersection of healthcare to give us a concrete example of why this is so needed. Dr. McDaniel?
Hello. And may I also add that I am on the Governor's Long-Term Care COVID-19 Task Force, and also the chair for the Education and Training for our Wellness Advisory Committee as well. And one of the things that we are focused on is wellness, health wellness, and mental health wellness for people that are essential workers, people that are on the front line, our frontline nursing staff. And one of the, I believe that CNAs are very much impacted in the long-term care environment, because a lot of times when they are ill, you know, they don't have paid sick leave. And so I just wanted to share a story. I got a call last week from one of my cousins. She's also a registered nurse. She's a director of nursing. And she shared the story about her daughter who had COVID. She was at home for, I think, 10 days. She was called by her employer and told, if you do not come back to work, I think it was like after the 10 days, that she was going to be fired. No one should be threatened that they're going to be fired from their job when they are still sick. So I think what's happening is they expect that COVID runs its course. And if you had COVID after 10 days, this is what she was told. If you have COVID after 10 days, you are good to come back to work. So
maybe.
So this paid sick leave is, it's imperative. We have to do something so that employees have paid sick leave. I don't think anyone here has said anything other than that we need to do something about this.
Excellent. That's a great example. And I actually took a call from somebody yesterday, a childcare, telling me about a situation with a childcare worker, where when the childcare worker called in sick and then asked if she could get paid for the days she was going to be off sick with COVID, her employer basically fired her for having the audacity to ask for paid time.
Wow.
And again, this is a childcare worker. We all know childcare workers don't make much money. So
Right.
we have one reporter has written a question asking what's happening in the General Assembly on this issue. How many bills and so forth are there? I can answer that question. There are 2 bills directly on expanding access to paid sick days. One is by Delegate Guzman. Her bill is an essential workers paid sick day bill that is focused really on these essential workers in the economy. And it covers all employer sizes and covers workers who work 20 hours or more. So most workers. This is the bill that the Virginia Paid Sick Day Coalition is endorsing. There's also a bill that Delegate Reed has introduced that we're excited about his interest in the issue as well. That bill is a broader paid sick day bill, so it would cover all workers, which we obviously really support that approach as well. It, however, exempts businesses with 35 or fewer workers from that coverage. And we are very concerned that that exempts many of the workers who actually need it. And so again, we've got 2 different options. I think what could happen is that both bills might end up getting passed and then they get sent over to the Senate. There is not a companion bill of either one of those in the Senate. And part of the reason is our Senate Commerce and Labor Committee, which is the committee that it's got to get out of first, hasn't made up its mind what they want to do. Increasingly, I think they understand that people are clamoring for paid sick days, that the polls are off the charts in terms of both Democrats and Republicans and independents wanting paid sick days. But what kind of approach they are going to do is yet to be seen. But we are having lots of conversations with the senators, and we are hopeful that we will get a paid sick day standard that, even if it's not everything we want, will take a first step forward in Virginia to creating a long-term paid sick day standard. Long-term, we need a standard that covers all workers, regardless of employment size, and even for part-time workers. So that's what we're going for in the long term. Now, the legislators, I do want to ask several of you on the panel. The arguments against this are primarily, how can we put another burden on small businesses in this time of COVID? This will be a difficult standard for businesses to implement. What do you all say to those arguments?
I would say it's the right thing to do. It's not like the employees are not getting sick. They're just coming to work sick and compromising everyone. And the impact of that can be mortality, death. So it's happening. And so they have a responsibility to do the right thing. So it's not like people aren't getting sick. They just don't have the means, so they're coming to work sick. And so that's a detriment to all of us.
I've actually heard one person say employers can't afford not to offer paid sick days because it endangers their entire workforce and their entire business. Ms. Cross, do you have any comments on that? Is it hard to implement a paid sick day standard?
So like I said before, I don't currently have any employees, but I will be adding 2. And my thing is, I know I'm going to offer that. I will figure out how to do it when the time comes, because I full-heartedly believe that it is my responsibility to treat my employees the way that I would want to be treated. And I would want to feel safe enough to call my employer and let them know that I am sick and that I tested positive for COVID and not have to worry about losing my job, I know that I will find a way to do it because it's my responsibility. I need to take care of my employees. And like I said, I want them to consider me as family. I want to consider them as family. I want them to want to come to work and feel safe doing so.
Ms. Myers, is it difficult to implement a paid sick day policy?
No, it's not. There's ways to do it where you can somewhat incentivize the employee. So you can call it flex days. You can call it a combination additional time that's put together. And so individuals that really value their vacation wouldn't abuse it unless they were really sick. So there's creative ways that you can incentivize employees not to have abuse around it, but to have the time allocated in some sort of model. So if they are sick, they do have it there to utilize.
Great. And both of the bills, both Delegate Guzman's bill and Delegate Reed's bill, both allow employers that have PTO policies, as long as they allow people to use it when they're sick or a family member is sick, as long as it has the flexibility, then the PTO standard meets the standard in Virginia for paid sick day. So again, it's a fairly flexible approach, and employers have the ability to figure out what works best for their business to be able to implement this. So I think that argument is not a strong one. So we've also been asked, what can people do who are listening to this who want to see a paid sick day standard in Virginia? So number one, call your senator, call your delegate, email them, ask them questions, tell them you want Virginia in this General Assembly to pass a paid sick day standard that covers especially essential workers, that's what we need right now. Secondly, if you're not sure, like, who is my legislator and what's their phone number and what's their email and how do I do this, we make it easy for you. So go to the website of the Virginia Interfaith Center for Public Policy. And so it's just www.virginiainterfaithcenter, all spelled out, .org. So go to the website and then go to the issues, and you can find paid sick days, and you can click on a link and it will tell you who your legislators are, and you can send an email directly. So we make it very easy for this. The other thing, if you want to stay abreast on this in general, and as it goes through the General Assembly and what you can do at various points in the process, you should sign up for Virginia Interfaith's email action list. All you have to do is type in tinyurl.com join VICPP, and you can get all the action alerts to stay abreast on this and other important social justice issues. All right, if there are no other questions, any last words from panelists about why we need paid sick days? I want to give you each the ability to say one last sentence on this. Ms. Myers?
Yes. Paid sick day standard is necessary. Please, please take action. Go out and reach out, and let's make this happen.
All right, Ms. Cross.
Okay. I do believe that if the paid sick leave is going to happen, we need to advocate for it. Don't be silent, and you need to speak up to make it happen.
Awesome. Dr. Montague.
I believe that paid sick leave is of utmost importance for the reason that you want to keep your employees working. If they're not working, and if they've spread it around the disease or the infection, such as we have in COVID-19, then you will have more people out, and your employment may not be as able to thrive as you would like it to be because you don't offer that. So yes, and I would encourage the workers who are not receiving paid sick leave to get in contact with their representatives, their Congress and let them know that paid sick leave is necessary for you to stay in the field of employment and in the workforce.
Dr. McDaniel.
Yes, I will add that everyone has a voice. You need to use your voice. You need to email, call. If you have the ability to text your legislators and let them know that paid sick leave actually can save lives. Because if you have a sick employee, again, coming into a assisted living facility or a long-term care facility, which is what happened here in Virginia, their families did not bring in COVID. A lot of times it was a sick employee who was forced to come to work because that sick employee did not have paid leave, paid sick leave. Please call your legislators, let them know that, and you can call them as many times as you want. You don't have to speak directly to a legislator. You can speak to their legislative assistants. They know everything that's going on with their legislators, and they will pass your messages on. Please, please, please make contact, be proactive. Let's get this done.
And 4 of the legislators in the Senate Commerce and Labor Committee who will be influential and instrumental in passing this are in the Hampton Roads area. It is Senator Lucas, Senator Spruill, Senator Lewis, Senator Mason. All 4 of them are on the Commerce and Labor Committee in the Senate, which is the committee that will really make this happen. So please, Hampton Roads is absolutely critical. And I want us to close out with Reverend Dr. Anthony Fludd.
I just want to say that your health is your most precious commodity. You have to speak out for the gift that God has given you. And you cannot let anybody take away that, especially in the climate we live in today. But I'll close with this. It is my prayer as a faith leader that we all become better people by looking out for each other. And we can be better if we learn how important it is to live a successful life and not be cumbered by all of the crises and concern of this day. So I pray that you be healthy and well and stay in good health and prosper, even as your soul prosper. Thank you.
Thank you very much.